Hi everybody, Dr. Baumholtz, Baumholtz Plastic Surgery. Happy Saturday morning. I got asked a question on social media this week that I thought was kind of interesting, and the question went something like this. If a person under the age of, let's say, I think the question was if they were under 20, they should not do plastic surgery, or was plastic surgery not advisable because you'd have to do it again or there'd be some sort of increased complication. And so I thought for a minute I would just walk you through my opinions about plastic surgery in younger people. And so I'm sorry if my handwriting isn't great for this presentation. If you'd like to know more, or if there's something you've got a question about, please text me or message us and we'll get back to you. But so this whole thing is called plastic surgery in younger patients, and I realize now that it's backwards for you, but we'll just go through it. So believe it or not, there's entire disciplines of plastic surgery that are devoted to younger patients, and so we'll start with the newborn to toddler phase, and in that group, there's a lot of plastic surgery that goes on. Fortunately, it's relatively rare, but there's an entire discipline known as craniofacially trained plastic surgeons, and they focus generally on cleft lip and cleft palate, but there's also other issues in young children, newborn children, that are addressed early on, and there are skull deformities or facial deformities and other things. Then as we get into the early school age, when a child is aware of some sort of differences, or maybe they're getting teased at school, we may talk about doing something with their ears, typically ears that protrude too far that need to be pushed back. There are some cases where children are born either without ears or rudimentary ears, and we're going to do something with that at that phase of their life. I put over here that hand, because there are some hand differences that can occur in younger children that we want to wait till they're a little more developed to do, although there are some things that we'll do younger, but this is generally true for that. And of course, I made the obligatory mention that we have to think about sunblock from the very early on all the way through. As we get into adolescence and puberty, we're going to start really focusing, or at least what we see, are breast differences. Often children that either a young woman or even a young boy where their breast starts to develop. In a boy, we'll call that gynecomastia. In a girl, it'll be symptomatic macromastia, and we'll talk about some form of a reduction. Breast differences, so a child, typically a female child, is born without a breast or a breast that doesn't develop the same way. There are some plastic surgery techniques where we can balance the one breast to match a more natural appearing chest. Getting into late college and beyond, we'll say 19s, 20s. I'm the father of a daughter, so grad school and beyond, or whatever it might be, whatever is fitting for you, we tend to see more of the breast augmentation. And again, in the males, we continue to see things about breast reduction for gynecomastia. Also from adolescent puberty and late college and beyond, we're seeing more and more attention paid to skin issues, particularly acne and just protecting our skin. Of course, sunblock goes all the way through. Well, that's a rough and ready answer to do we do plastic surgery under a certain age? Oh, I did want to make a couple points. Rhinoplasty will show up in sort of the adolescent puberty in the first wave. Typically, we see it as a bimodal, meaning 2 times in life. What I tell parents that bring children that are young with significant nose differences is that unless that child is fully developmentally or skeletally developed, there's a chance that there'll need to be a touch-up or a secondary surgery as their face continues to change and grow. And that's true in a lot of things in younger age patients, where there may need to be some additional work done as the child goes through the different stages of growth. Generally, when a young woman is as tall as mom, generally, not all the time, but generally when they're as tall as mom, we can really focus on delivering a product that is, or a result that is going to be more long-lasting for them without the need to revise it repeatedly. When it comes to breast implants, of course, these are not lifetime devices, so the younger you get them, the more you'll have more iterations of redoing them as time goes on. We can talk more about that in person. Well, I hope that answers your question. Have an awesome rest of the day, and as always, if you've got questions, please ask them to us. Thanks so much.